Hello and good afternoon. I see we've got a lot of people on our media briefing today, and so we're going to go ahead and get started. We have a full agenda for you today, and of course the topic is going to be COVID-19 and healthcare. And we are very pleased to be joined by representatives from our hospitals here in Monterey County to walk us through not only, all the things we've heard about and all the things we need to know, but what is their perspective on the needs of our healthcare during this time. And we're going to start with Dr. Martha Blum from Community Hospital. Thank you very much, everyone, for joining us. And Martha, won't you lead us off?
Sure thing. Thanks, everybody, for joining today. And I'm glad that we can all be here to provide you the most up-to-date information because it's a rapidly evolving situation. And unfortunately, everybody needs to stay on top of the situation as it continues to get, quite frankly, worse each day. We've all been speaking about what our ICU capacity is because now that's obviously the hot topic as everybody wants to know where we are in terms of triggering the regional stay home order. I can tell you that here at Community Hospital, our ICU has been at or near capacity, and last weekend was actually over capacity. And it's been like that for the last week. So we are presenting publicly our ICU capacity on our webpage at chomp.org. So people who are interested to see that. But again, I caution you that those numbers fluctuate hour by hour, day by day, as we do our best to play this elaborate chess game to be sure that all our patients can be properly cared for. And again, we continue to respond and adjust our surgery schedules as needed so that we can accommodate all the patients that are coming in for care, both COVID and non-COVID related. We've seen a rate of increase unlike anything we saw in the summertime or even back in March when the pandemic first arrived in Monterey County. And again, our main limitation is having enough of trained staff, particularly nurses, respiratory therapists, and other support staff to care for all the patients. So even if the beds are there and when people are looking at those numbers that are being reported publicly, and it looks like maybe when you look at it, it looks like there are plenty of ICU beds and plenty of beds. The reality in many cases is that we just don't have enough of the staff to support huge increases that we're anticipating in the next couple of weeks.
Thank you very much for that overview. And then we're going to turn to Dr. Craig Walsh from Natividad. I've kind of got a rundown of all the things that everybody's going to talk about, but are you going to touch on kind of how the hospitals are working together? Because really the pandemic affects everyone.
Certainly, and you said that absolutely correctly. This is affecting all of us. This is affecting the 4 hospitals in Monterey County, definitely. We are all seeing a lot of the same issues. We are coordinating very closely, and that's something I think we can all be proud of, is the level of cooperation we're seeing between our staffs. We're talking about staffing amongst ourselves every 12 hours, if not more. Patients have at times been transferred from facilities that temporarily maybe had less capacity to ones with slightly more. So we are collaborating. We're collaborating around the distribution of medications. We're collaborating around our knowledge base and how we have learned to best take care of patients. But I cannot reiterate or support Dr. Blum's statements more. Our hospitals are here. We will do what we need to do to take care of everyone and provide them world-class care. But our community needs to understand that we are now in the thick of the pandemic, the way we've heard about it in other parts of the country and other parts of the world. And really all the citizens of Monterey County need to be a part of the solution here. We are all in this together. This virus does not discriminate between zip codes and identities or whether you're closer to one hospital or the other. The virus doesn't care.
Interesting. Thank you for that. And you couldn't have put it more succinctly. And now we've got Dr. Alan Radner from Salinas Valley Memorial Healthcare System. And I know, Dr. Radner, you are famously saying we'll put people in the hallways if we need to in some of your comments. But I'm hoping you'll tell us a little bit more about overall capacity issues and a little bit more about the ICU metrics.
Yeah, we've been on a lot of calls the last few days, and I know there was a discussion yesterday, the Board of Supervisors meeting about ICU capacities. And as Dr. Blum's already pointed out, this has become a critical issue with respect to whether we're going to open or close, to what extent our community. And, again, I'll just reiterate what we've said before. There's a lot of nuance to what we call ICU capacity. There's historic fixed ICUs with licensed beds. We've all figured out ways to expand that, what we're calling surge ICUs. Honestly, there's a lot of patients right now who in the pre-COVID era were ill that we would monitor in ICUs, that now we monitor in what we call progressive beds. But the reality is in totality that, using historic metrics, we're all well beyond 100% capacity. We've never experienced these kind of numbers that we're trying to take care of in this number of ill patients. And again, as Dr. Blum has pointed out repeatedly, we clearly anticipate this getting worse as the holidays. We're now starting to see an influx that we think was related to Thanksgiving, and we're concerned about the future. We've also kind of pointed out that I can basically turn any bed in our hospital into an ICU if need be. And some of the hospitals have varying capacities. We have some capacity at Memorial Hospital, not in traditional ICUs, but as we've stopped elective surgeries and we're trying to lessen the number of people that come into the hospital for non-emergent reasons, we have extra beds. And if we had to, we could turn them into ICU beds. We have ventilators, we have PPE. Our problem, as you're hearing over and over again, is having staff that can take care of this number of critically ill patients. So as we've been saying, we'll do what we have to do. We'll find ventilators, we'll find beds, we'll find locations, we'll take care of people, but it's really getting to a point where it's certainly not, or potentially not at the level that we've taken care of patients before. When you have a shortened staff and you're really you have a compromised number of people taking care of a large number of very ill patients is obviously very problematic. And then the other point that we've been making is that we're, one of our levers to try to deal with these volumes is to cancel elective surgeries, but that also is a nuanced term. We have people that need cardiac surgery, that need brain surgery, that need things that I don't think many of us would call elective. We can put them off for some period of time, but not indefinitely. And we are putting those off, and that's very problematic. And at the same time, we're trying to take care of real emergencies that are non-COVID related. So across the board, it's a real challenge. And with respect to the metrics, I had a discussion with the health department this morning, and somebody from the health department can kind of give you a more sophisticated answer. I got a kind of a 30,000 foot answer, but what's publicly reported is kind of this weird derivative of a bunch of variables based on licensed beds, based on beds that we're calling surge ICU beds, based on how many COVID patients are in the hospital. It's kind of a complicated equation that the state has basically made up for this period of time. And it isn't reflective, as we've said over and over again, of the number of people that are in our ICUs right now and the challenges that we're facing on a daily basis.
Thank you for that. And then we're also going to Dr. Robert Valadares from Mean Memorial. We can't forget we have 4 hospitals in this county, and all of them play a very important role. And I'm hoping you'll talk a little bit more about, what is happening with me, and then also how should people approach their health care? Dr. Radner was just saying some things may have to be postponed, but that's not always a good thing.
Yes, thank you. Are you able to hear me well?
Sure can.
Great. So I thank you for recognizing that we are all working together and that there's 4 hospitals in the county because, Mean Memorial is a small critical access hospital in South County. We have 25 acute care beds. And what we're doing is, it really took the pandemic to bring us all closer together. And we're working very well together because over the last week, We went from having no inpatients last Sunday to having 8 inpatients this Sunday, 6 of which were COVID transfers from the neighboring hospitals. So what we're doing is we're taking the lower acuity patients that only need some oxygen, a steroid shot, their home medications, and we are working closely with the other hospitals to have them transferred to Me Memorial so that they can recover here and, you know, free up the hospitals with more advanced capabilities like Salinas and Natividad and CHOMP to take care of the more ill patients. So that's currently what Me Memorial is doing. And as you alluded to, right now, I want to remind the public that they really should not be taking it upon themselves to make the decision to put off their medical care without consulting their physician. The physicians are there to help the public decide what is something that they really need to come in person for a clinic visit, or what can be taken care of via telemedicine, which during the pandemic, you know, all the hospitals have really stepped up their ability to render care, you know, via telemedicine, and what can be postponed. During the first shutdown in the spring, what we saw is that a lot of patients took it upon themselves to make the medical decision to postpone their care without seeking the input of their physician. So we had a lot of patients that actually had their chronic illnesses get much worse because they were not being cared for by a physician for many months. You know, as we remember, the first shutdown was going to be 2 weeks and it lasted much longer than that. So what I want to remind the public is to please reach out to your physician and have a conversation with them as to whether you need to come in for your visit or have it done via telemedicine, or whether you can postpone it. The other thing I wanted to share with the public is that hospitals are very safe right now. I will go on record and say we're safer than going to Target or Home Depot or Walmart. The infection control measures that the 4 hospitals have undertaken when it comes to their disinfection practices, keeping the COVID patients, you know, isolated. It's a very safe environment to come get medical care at a hospital right now. The other thing that I wanted to share is that the flu shot is available and is very important this year. We've had our infection control doctor, Dr. Nazreen Khairisha, join another media call to remind people how important it is that people get their flu shot this year. And, you know, it is available. You know, children should still be seeing their pediatrician and getting their vaccinations. So, you know, to sum it up, we are working very closely together, and we really want the public to call their doctor and have the conversation with them as to what is urgent and non-urgent. I really don't want the public making that decision without the experience and the guidance of their physician.
Advice, thank you. And then I've got the high sign from Dr. Blum, who wants to chime back in.
Right. You know, the other thing we wanted to speak to was about holiday planning and travel planning. Certainly, we get lots of questions now about whether or not we're in the regional stay-home order or not by the time the end of the month rolls around. You know, what are safe activities? And right now, the recommendation is to try and stay within your small bubble of your immediate household as much as possible. We know that there is risk out there in pretty much every activity that you would do outside of your household where you interact with people that are from other households. So regardless, you know, we talked about social circles and having bubbles. Right now, the recommendation is to keep that as small and as tight-knit to your immediate family as possible. I know a lot of people let their guard down when they're with members of their large extended family or with neighbors or close friends where they feel like the risk here has, it's not that much different than being outside of my household. But again, that's where we're seeing large clusters of cases is within multi-family gatherings. And we're just, like I said, beginning to see some of the cases come in related to family gatherings from Thanksgiving. So it's certainly ramping up, and the risk is getting to be great. So that being said, if members of the public have a known exposure to someone who is positive in their family, we recommend immediately beginning a quarantine. You don't need to have somebody tell you to do that right now. It's very important to really diminish the spread in the community by knowing that if you've had an exposure, you need to quarantine yourself. And we also reiterate how important it is for people who are COVID positive to maintain isolation for 10 days. And this means that you need to get assistance from people to bring you food and medicines. The isolation when you're COVID positive really means staying home and not going out for anything. So not taking public transportation, not taking Uber. Really, the only reason someone in isolation should leave is because they need emergency medical care. So we just can't emphasize enough that if you are known COVID positive or exposed to someone who's known COVID positive, isolation and quarantine is super important. We have more testing capability in the county now. We have a new OptumServe site that opened up in Castroville. It's been there for about a week now, and it had a really great turnaround time and high numbers of people seeking testing there. We still have the site, the OptumServe site in Seaside, as well as the one in Salinas. So if somebody's had an exposure and is concerned and wants to get tested, Castroville, Seaside, Salinas OptumServe testing sites are great places to access testing without the need for a doctor's visit and without the need for any type of doctor's order. But if people are ill, then of course they should seek medical attention and assessment by a medical provider to go along with the test. But if asymptomatic and exposed, I highly recommend utilizing those state-run OptumServe sites.
Thank you. And does anyone want to touch on vaccine? Everybody's waiting for that light at the end of the tunnel, hoping that a vaccine will come. How does the specter of the vaccine impact the hospitals either now or looking ahead? No one?
I'm happy to talk about that and have my colleagues weigh in. So yes, we are expecting in short order the arrival of our first allotment of vaccine. We do not know exactly how much we will be getting, but that will be distributed, and our first goal will be to immunize, vaccinate those healthcare workers who are in direct contact with victims of COVID-19, and also folks that maybe handle samples of COVID, for example, lab workers. And if you think about it, that makes ultimate sense. We need these people well to be able to care for those who succumb to the illness. So I think there is light at the end of the tunnel. We will have to work hard to both correctly roll out our immunization program, but also to educate people to the importance of being vaccinated, the importance of encouraging vaccination, to the importance of understanding the science behind the recommendations. I think is going to be just as important as getting syringes and nurses and vaccine candidates together. We're really going to have to think about how do we really realize that light at the end of the tunnel. There are going to be folks who we need to educate and bring along, and I think we can do that. We will do that. And that's one of the big challenges ahead.
Thank you for that. Is there any, does anyone else want to chime in on that or any other subject? I've got a question in chat and might be getting some more before we drop off and answer questions. Is there anything else you all would like to say?
It looks like Alan was going to say something.
Sure, I would just like to add, like everything Craig said is right, spot on about vaccines. But the only other kind of message here is that it's been a really long, difficult, 8-9 months, and everybody's tired and fatigued and exhausted. But the vaccines look remarkably effective, and it feels really horrible when we're having people come in now at an unprecedented rate and seeing people dying. When we think if we can just stave this off for a few more months, there's going to be significantly fewer people that die. So it's kind of, there is a light at the end of the tunnel. We're very optimistic, and it's just tragic and sad and frustrating to see this dramatically increased number of people that are ill and are dying. When we can just hold off a few more months, it really could dramatically impact the number of people that are ultimately, affected by this. So I just wanted to add, that hope that people will really, look at this period of time as, while it's tough, to really kind of fight through it. And there is a light here, and it looks very, very promising.
Thank you for
And
that.
the last comment I would want to make about the vaccine is that if anyone is really, on the fence or, debating whether or not to get it, I would emphasize that the vaccine is really our way out of this pandemic. We need to get high level immunity to this virus, and we don't want to get that level of immunity by everyone getting infected. The vaccine is really the way for us to get to that, 60, 70, 80% herd immunity. So when people are wondering, what they can do, how can we make this come to a close any quicker, I would say get vaccinated.
Boy, coming from you, that's, can we make it like doctor's orders? All right, unless somebody else wants to add anything, I've got a couple of questions that I could start in on, and this is for all, these questions are for all of you. Are any of the hospitals considering asking the county to let them use the alternate care sites that had been previously talked about and or set up?
I guess I can hit it first, but Craig was kind of our expert on setting those up. I mean, the problem that we've talked about right now is not so much absolute number of beds, it's staffing. And unless we had some outside resources from the state or the National Guard or someone to help us, it's not going to be a whole lot easier to have an alternative site where we have to dilute our workforce even more to cover an alternative site. It's just easier to use places in the hospital like your PACU recovery area, other areas in your hospital, any free bed. It's still a conservation of kind of force by trying to keep them in one location. When we move to alternative sites, we're just, again, unless there's a significant influx of outside resources, it's just going to dilute our abilities and not really offer a lot. If we got to that point where we completely utilized all of the bed capacity in the institutions, that's something we would consider. But again, it's not something without outside help that we could easily manage at this point in time. Do you agree with that, Craig? You're kind of our expert.
Sure do. Yeah, sure do. So, it's not about the space at this point. It's the staff that's the rate limiting step. And there are a lot of potential spaces inside the 4 hospitals. It's the staff that would really determine how much care we can provide, not the location.
All right, then I'll move on to the next, unless anyone wants to jump in on that one, I'll move on to the next question. For all the doctors, are you aware of any evidence or science that indicates that prohibiting outdoor dining would reduce COVID-19 infection rates in Monterey County? Not, so I think we don't have an answer for that one. Is there a place we could direct people for if they wanted to look up any research?
I would just refer them to the California Department of Public Health and Dr. Mark Ghali's comments on the decision to include restrictions in outdoor dining in the regional stay-at-home order. He gave a good answer to that question, and I would just refer them to his answer.
Okay, thank you very much. Continuing with the questions, how much outside help are hospitals receiving right now, and how much more do you need? Does anyone want to start with that?
Well, I'm not sure exactly what is meant by outside resources. We're all trying to get temporary additional staff through nursing. It's incredibly difficult. You know, I think outside of the institutions, we're getting support from Monterey County Health Department to various levels. They have a phenomenal lab that's been helping, and there's been other areas, but essentially, you know, we are what we are. And I think I think Martha and Craig already alluded to this or mentioned this explicitly. It's just shocking how we've all kind of banded together and worked together. Right now, we're on this call while there's another call going on with all the hospitals talking about resource allocation and planning and strategy and communication. And we're all kind of feeling like it's us now, and we're working together and doing the best we can.
Does everyone else feel the same? Oh, go ahead.
I want to echo Dr. Radner's sentiment that the help that we've received has really been by banding together and pulling resources, because I would say that, you know, at a federal level, our hospital has not received nearly the amount of help that it needs. We are really struggling with staffing, specifically nurse staffing. We have a lot of room in the hospital that we could put additional patients. As a result of the pandemic, we had to suspend our labor and delivery department. So we're now using those beds to be able to take more patients, but we don't have the nurses, and the travel nurse rates have gone up significantly to where our hospital just cannot afford to bring those travel nurses on because the rates are so high. And without there being another stimulus that is really focused on helping hospitals, we are going to continue to struggle to get by from a financial point of view. So that is our perspective here at Me Memorial. We did not receive nearly the amount of financial aid we needed to be able to survive this shutdown without having to shut down significant parts of our operation, like our labor and delivery department. And right now, I am so far have not seen much hopeful progress in the stimulus discussions that there's going to be the amount of aid that hospitals need to really make it through the pandemic without having to cut in areas that really should not be cut.
Any other thoughts on that last question before we go on to our next question? No? All right. For each of the doctors, do you support a preemptive shutdown or opting? I think what they mean in an early opt-in to the regional health order of Monterey County.
I'll just make a comment to say that we're going to get to that metric sooner rather than later. And we know that the more that people are out there interacting with other people, putting themselves at risk for exposure and infection, that there is no way that this upward trajectory is going to level off and go down unless drastic measures are taken. So, each day that we continue to keep doing what we're doing is another day that curve is going to just continue on its very sharp upward trajectory.
Any other, does anyone else want to answer that, or is that answer good for everyone?
Yeah, I'd add to Martha's comment that I think, it's unfortunate that it's coming to this. And I think that, lockdown, quote unquote, by itself isn't going to fix this. It's kind of a blunt instrument, and it's unfortunately needed because people where we're here, we see patient after patient after patient that's traveling, having parties. We know that there's people that should be in quarantine and isolation that aren't following guidelines. The health department is having a very hard time doing meaningful, timely testing and contact tracing. There's very limited enforcement of these mandates. So, just by itself, it's a really blunt instrument, and it's not going to get us ultimately by itself to where we're going. And we'll probably, again, this is a race. This is going to keep happening over and over and over again until we have immunity in our community. And that's either going to happen over a very long period of time with a lot of really sick people that are dying, or a vaccine. And we need to do things over the next few months while we're waiting for the vaccine. And just to do more of a lockdown, if people aren't following it, if it's not enforced, if there's still parties, if there's large gatherings, if there's irresponsible behavior, it's going to help, but it's not going to fix what we need to do. And I think one of the pleas you're hearing from all 4 hospitals, I mean, we're being asked all these questions about what happens in our ICUs and what happens in our hospitals. And what we're pleading is for people outside of the hospitals to do what needs to be done so we're not flooded. We need to prevent this. We'll manage what we have to manage, but the plea here is for all of us to act responsibly and to really try to mitigate the number of infections in our community.
Thank you, Dr. Radner. Any other thoughts before I move on to the next question?
Yeah, I would support the statements of my colleagues, and I'd just like to make the analogy that limiting our behavior, doing the right thing, and you've heard the messages. I don't think anyone's lacking in hearing the message at this point, but think of it as an investment. Think of the holidays that we're going to have to sacrifice a little bit this year. That's an investment that's going to pay huge dividends for holidays in the future. And I believe there's an analogy there with economics too. I'm certainly no economist, but a little investment now is going to bring us that much closer to life as we knew it in the pre-COVID times. The behaviors we want to do, the places we want to go, the things we want to do with our friends and family, we'll be able to do those again. But we'll be able to do them a lot quicker if we do the right thing now. Ounce of prevention is worth a pound of cure.
All right, thank you. Then we'll move on to the next question unless somebody else wants to jump in. In terms of daily new cases and or hospitalizations, at what point would make you certain that we would run out of ICU beds, and what would happen if we do run out of ICU beds?
So I think maybe this is trying to get at the heart of, how big are our surge plans? Like, how much could we surge? But of course, there is a limit at which we could no longer care for people, all people that are coming to us for services. So we've already started talking about how the hospitals have had to cancel non-time sensitive surgeries or elective surgeries. Because we're not able to accommodate those people who have a surgery that can be put off to a later date when we do have better capacity. So that's only one of the first steps. Again, if it continues to escalate, we can get to the point where we're making these very difficult decisions about rationing care and deciding who's sicker and who gets treated first. And that is certainly a place that none of us here want to get. So that's why we're here pleading and urging that if we can do anything and everything in the community to stop ongoing transmission, we won't get to that point. But certainly all of the hospitals have their surge plans, and everyone here locally, as well as the nation at large, has these plans for what to do when you get to the point where you have to make really tough decisions about who gets that ventilator or who gets that hospital bed.
Thank you, Dr. Blum. Anyone else want to chime in on that one before I move on to the next question? No? Okay. Next question. Do you have staff moving between hospitals? And where are mothers who would deliver at me going to have their babies?
So I can take that one. We do have staff moving between hospitals. Currently, our 2 family practice and obstetrics trained physicians, they did their training at Natividad, and now they're physicians at Me Memorial. So what they're doing is they are delivering those moms who would have delivered at me at Natividad Medical Center. So that's our experience with what we're currently doing while our labor and delivery department is suspended. We are still seeing those moms in our clinics for all of their prenatal care. It's just the deliveries that are not happening at me. And it's not ideal, but like I said, it's one of those things that we had to do to make sure that the hospital survived the pandemic.
I would just point out that we've always shared staff. We've always shared nurses and physicians and others. We're a small community, and one of the neat things about the medical community in Monterey County is that there is a closeness that comes from the doctors, some of whom are with us here today, and nurses that travel throughout multiple hospitals and can share those best practices. So yes, we're used to sharing.
Right, thank you, Dr. Walsh. Anyone want to jump in before I move on to the next question? Okay, then I'll move on. The county's COVID-19 dashboard shows 10 new deaths today. Is that, excuse me, this thing moved on me. Is that the highest number since the pandemic started? And this may be a question for the health department.
Yeah, I think it is a question for the health department. I mean, one of the things that everyone needs to realize is that the numbers that we see obviously can be, there'll be things like one day there'll be a large run or a large influx of labs, and the next day, for whatever reason, there won't be a big influx. And the numbers on a day-to-day basis don't accurately necessarily reflect what happened that day. The health department is extremely busy, and they're trying to import data and keep it up to date. But oftentimes they'll be a day or two behind and representing some of the numbers. I don't think there's any question, though, that the number of hospitalizations is the all-time peak. It's continuing to rise, and we generally don't hospitalize people who aren't extremely ill. And we have no doubt that the number of deaths is also increasing. So I don't want to speak to whether today's number is exactly accurate and how it reflects some other day, but absolutely no doubt that's the trend that we're seeing.
Thank you, Dr. Radner. Another question. There has been an effort to educate the public about the virus since the pandemic started months ago. Do you believe it has gotten to the point where police and sheriff's offices need to step in to do more to enforce current health orders and orders pertaining to the regional stay-at-home order? When does educating the public maybe shift to enforcement? And I know, Dr. Walsh, you mentioned there just isn't anyone who hasn't heard the messages at this point, but do we need to step it up?
I think it's past time. I think we would have benefited from having more enforcement, or at least more of a presence out there to know that there would be consequences for violating some of these very basic prevention measures. And although we're not in the regional stay-at-home order right now, we do have a curfew from 10 p.m. to 5 a.m. And even that has not been strictly enforced. And, it's not that COVID only comes out at night. I know people kind of joke about that, but certainly, just having a presence and knowing that those large gatherings and parties and things that are happening, if they're after curfew, having some enforcement out there just to reiterate that these are all the very basic things we can do to prevent spread and transmission in our community would really hit home and hopefully get people to appreciate that there is really some personal responsibility here to not only ourselves and our family members, but to our whole community.
Thank you, Dr. Blum. Anyone else want to add anything before we go on to the next question? No? Well, if this one is for all the doctors, Dr. Anthony Fauci last month said schools should be open for classroom instruction. Do you agree with that, or do you want to comment on that? No? Okay. So we're going to just refer back to Dr. Fauci for his comments.
I would refer people there. There's a lot of great resources, as everybody knows, but the University of California, San Francisco does usually a bi-weekly grand rounds that you can find on YouTube that's talking about critical issues related to COVID. And last week, there was a detailed discussion about opening schools that was phenomenally good. And I would refer people to look at that or listen to that. So they talk about the pluses and minuses, and I think it's a really intelligent discussion by some of the world's leaders in this area.
Thank you. Great. And then this last question at this point is, how many ICU beds do the hospitals normally have available at this time of year? Maybe the winter trends versus summer trends.
Natividad's licensed for 10 adult ICU beds. We also have a neonatal intensive care unit, which is another story. I don't have exact numbers for you, but I can tell you that our ICU tends to be busy and is busier in the winter months when we see respiratory illness more prevalent than in the summer. Exact numbers, I don't have my fingertips, and I'm not sure that they would really be that helpful for folks who are trying to make sense of what's going on.
Does anyone else want to chime in on that one? No. And then I had a request for Dr. Valadares. Do you want to talk a little bit about ICU capacity and support at Me Memorial?
Yes, so we currently are licensed for 4 ICU beds, but we currently don't have the critical care nurse staffing for those beds. So what we have been doing since the beginning of the pandemic is we're using the ICU to expand our emergency department's capacity to deal with respiratory illness. So when patients come in with respiratory complaints, we use the ICU for that reason. So it's our emergency department nurses that have been using that. And as far as, just the capacity from a different point of view, it's not just the hospitals with ICUs that are being affected with the increased amount of COVID cases that are in the ICU. It's also the hospitals without an ICU. We've had a lot of difficulty this week transferring patients that need an ICU because the hospitals are getting so overwhelmed. So it's really affecting the entire county. We've felt that down in South County. So if something is happening in Salinas, it affects us down here in South County too, which is why it's so important to really listen to these recommendations to decrease the burden that the hospitals are currently dealing with. Right now, I think that if anyone goes to a store, they see that a lot of times social distancing is not being followed. Social distancing works. And some of these places, because people are afraid of a coming shutdown, they decide it's a reason to go pack into the store and not social distance and not wear a mask and get into a crowded line. So at some point, people do need to take on a greater level of personal responsibility, because being irresponsible is affecting everyone in the county at this point.
Thank you for that. And the reporter who asked the question was wondering if you could provide the same answer in Spanish. Is that something you're comfortable doing?
Yeah, sí, lo que estaba diciendo es que ahorita lo que está pasando es que no tenemos muchos recursos para poder cuidar a los pacientes que necesitan cuidado intensivo porque los hospitales están bien llenos y nos está afectando aquí en la parte de la condado donde está el hospital de Mi Memorial porque aquí normalmente lo que hacemos es que cuidamos a los pacientes que no están muy críticos, los que necesitan un especialista y necesitan estar con un cuidado más intensivo. Normalmente los mandamos a los hospitales en Salinas y en Monterey, pero ahorita esos hospitales están bien ocupados, no tienen mucho cupo. Lo que estaba diciendo es que es muy importante que todos tomen más responsabilidad personal para mantener su distancia y usar su máscara, su cubrebocas y lavar sus manos para que los hospitales puedan tener el cupo para poder seguir combatiendo contra el coronavirus y para que lleguemos a un punto donde ya la vacuna esté aquí y así podemos llegar a un nivel donde los hospitales pueden seguir cuidando a la gente. Eso es muy importante que la gente tome esta responsabilidad personal para que los hospitales no estén tan ocupados. Y lo otro que dije es que para que sepa toda la gente que está escuchando en español, es muy importante hablar con su doctor para cuidar sus medicinas y sus problemas médicos, porque lo que yo vi es que mucha gente decidió no ir al doctor en marzo y se empeoró. Su diabetes y su presión alta se empeoró. Es muy importante que llame a su doctor porque hay gran posibilidad que el doctor sí quiere que vaya a la clínica o sí quiere que vaya a la sala de emergencia. Y si el doctor decide que no necesita venir, ahora tenemos muchas capacidades para hacer cosas con telemedicina. Igualmente como hace FaceTime o hace Skype o hace WhatsApp a sus familiares, los doctores también lo pueden ver en su teléfono y lo pueden ayudar. Antes de cancelar su cita o no ir a su cita, por favor llame a su doctor y hable con ellos para que ellos puedan hacer esa decisión con ustedes.
Thank you very much for answering it twice. Most appreciated. And then Dr. Blum, we'll touch back with you for some additional information from CHOMP.
Right, I'm going to go back to Joe's question about how many ICU beds does the hospital normally have this time of year. So we were able to pull some information. The last 3 years, our ICU census had been between 11 and 14 beds occupied. Again, we have 20 beds. And so far this month, we've been running 16 to 20 out of 20 beds occupied. But it is indeed our peak time of year for respiratory illnesses of all kinds, including influenza and pneumonias. So even that 11 to 14 would be a higher level occupancy. And so certainly now that we're running 16 to 20, it's a big difference.
Thank you very much. And then I've got one last question in here, and I think you may have answered it before, but I'm going to ask it again. Are you confident that a more restrictive shutdown of Monterey County will reduce the infection rate here?
Yes. We saw it happen earlier in the year.
All agree?
Yep.
Yeah, but the thing to point out too is that it doesn't happen instantly. Even back in March, from the time that we started the stay-home shelter-in-place order, it took a couple of weeks to see that curve really bend and turn around and go in the other direction.
Thank you. That is all the questions that I have in chat. And let me just check and see if anyone has, does anyone have anyone on the call have any last questions for any of our physicians? Not seeing any. Oh, Dr. Radner.
Yeah, I just wanted to add one thing. Since this is mainly a call about talking about what's going on at the hospitals, and I'm sure all of the people on the call would share in this message that it's almost impossible to acknowledge and thank the healthcare providers who are working in the hospitals right now. This has been months and months in very scary times. They're worried about themselves, their families, and people are coming in and working extra shifts and doing just an incredible job. That, you know, again, I could call out so many people, but especially the ICU nurses, the intensivists, our palliative medicine doctors, the ID doctors, the phlebotomists. There's a lot of amazing heroes in Monterey County who are coming in and taking care of patients, and we just really want to acknowledge them. So I just want to thank them for what they're doing.
Thank you. And then as there are no other questions on that positive and inspiring note, we're going to wrap up our media briefing for today. Thank you all very much for coming in and spending an hour walking everyone through so many of these complicated topics and issues that are so important. That will wrap up the briefing for today. Our next briefing will be next week, and we'll see you then. Thank you all.